Welcome back to Weekend Prime. When Kenya embraced devolution in 2013, it was a promise, a dream to bring essential services like healthcare closer to the people. But 12 years into devolution of the public health care delivery, has Kenya delivered on its promise to ensure quality, affordable and accessible healthcare? On this episode of Health Digest, Gloria Milimo interrogates healthcare delivery under devolution. Take a look.
The Hola County Referral Hospital in Tana River County is a beehive of activity. The facility is a lifeline for patients like Ali Salah, who is a renal patient. 2 years ago, he would have been forced to seek for dialysis services from the neighboring counties like Garissa. However, the decentralization of power and resources introduced in 2013 has brought these services closer to patients like him.
Ningeenda Garissa ama niende Mombasa Malindi ningetoa transport. Sasa tunaona hapa nikiwa hapo niko nyumbani transport itakuwa nitapiga mguu na nikuja hapo.
For a county that has long grappled with maternal mortalities, making giving birth a life or death affair, the availability of comprehensive maternal services has helped women like Bahati Mohammed embrace hospital delivery, minimizing chances of complications during or after childbirth.
First born na second born nilizalia nyumbani. Na hawa wanne nikaza hospitali. The
delivery, to my side, I'm putting at the average of 175 deliveries per month.
But even with devolution of these crucial services, the public health sector is still faced with numerous hurdles. An audit of the health sector under devolution reveals stark gaps and myriad challenges that continue to threaten the delivery of health services in public hospitals. One of the biggest challenges when it comes to devolution is the shareable revenue between the national and county governments, a subject that has sparked controversy since the advent of devolution. County bosses say they require a significant higher allocation to sustain service delivery like healthcare and uphold the principles of devolution. The Council of Governors Health Committee Chairperson Muthomi Njuki has called for a review of how resources for health is shared between both tiers of the government. Sentiments echoed by the Council of Governors Vice Chairperson Mutai Kahiga.
We must agree that devolution is under threat, and more so even as it starts at allocation of resources.
It is not a secret that there's competition for resources between the two levels of government.
Other teething problems the sector has faced under devolution is the perceived encroachment of the functions of county governments by the Ministry of Health. Experts reckon there's need to find balance between national oversight and county autonomy.
The Ministry of Health is supposed to be coordinating policy, supposed to be ensuring the enforced standards, and they also have training. Why do we still have hospitals being still built in the counties from MOH?
How do you even know whether a community health worker or a CHP in charge of 10 households in Karachuonyo in a village somewhere went to work, but they are paid their share of 2,500 from Nairobi?
The initial national government's leasing of medical equipment under the Managed Equipment Service project was also viewed as a direct infringement on county authority. County governments required an upfront capital in order to access the medical equipment. However, the project that was surrounded by controversy due to lack of clear service agreements and frequent downtimes has now been replaced with a National Equipment Service project that seeks to ensure that public hospitals across the country are equipped with diagnostic and treatment technologies.
Since June 2025, Over 60,000 medical services have already been delivered in 29 health facilities across 18 counties.
Additionally, 290 medical equipment units supporting various health services have been distributed across the country.
Kenya's health sector under devolution has faced significant human resource challenges, including shortage of workers and frequent industrial disputes. To address this perennial challenge, budgetary allocation for training and hiring of adequate personnel is advised.
The Ministry of Health headquarters alone has about 300 doctors who are professionals, and we wonder what they are doing in that ministry, walking around carrying files when that is not what they were trained to do.
12 years after devolution, the health sector has seen both advancements and persistent challenges. While there has been improved access to some services, particularly maternal health and primary care, issues like funding, resource allocation and staffing persists. This, according to experts, impacts on the quality and efficiency of healthcare delivery across counties. Experts say strengthening of county health systems and addressing these challenges is crucial for achieving universal health coverage and improving health outcomes of all Kenyans. Gloria Milimu, KTN.